In the heart of Freetown's largest informal settlement, Susan's Bay, women face a relentless cycle of unpaid care work that limits their opportunities for education and employment.
Really excited about one of the interventions that we're doing within our Transform Freetown Transforming Lives development agenda, the CareBlocks. And the CareBlock is filling a gap that our cities had, a gap that relates to mainly women, carers who provide support to the elderly, to children, to the disabled, carers who aren't paid for the work that they do, but whose work is extremely valuable and society couldn't really function without it. And what the Care Block seeks to do, following on the model of Bogota, is to create a space for women to have rest and respite from that unpaid care work, but also to have the opportunity to fulfill some of those ambitions by having access to education, skills training, medical facilities, whilst of course having those that they care for being cared for by someone else.
I'm Damna Sakamara.
Namina is Takagbo.
Your name is Fatima Tamasi Kagbo. Early morning, why I don't take care of the kids, I don't go to school from their account stop and business.
You work in the morning. I get about 6 picking the way they feed.
When I don't go to school, I can go to the market, I can do my business. So that business, I don't always survive. That they take care of me, picking their pay school fee. It's not easy. Go one great person, they go all them children, they take care of picking, pay school fee, feed them. It's not easy.
We're an international network of cities dedicated to advancing the rights of women and girls. And so we're a hub for municipal governments to build and improve strategies to make their cities safer and more inclusive for all. So Freetown Caring City is an adaptation of an initiative that started in 2020 in another change city, that's Bogota, the capital of Colombia. And at that time, the mayor sought to tackle an issue that was happening in her city, but was actually happening in every city around the world, which is the issue of time poverty amongst women and girls, specifically time poverty that relates to the delivery of caregiving in their families and communities. And that's because everywhere around the world, women and girls are disproportionately responsible for delivering care, and that burden is especially heavy amongst women in low-income communities. And what that means is that they might have a harder time staying in education, a harder time entering or remaining in the labor market. They'll be more physically drained and financially precarious. The project is led by Freetown City Council, and in the team, we have the Sierra Leone Urban Research Center, SLURC, who drive the research, while the Women's Leadership for the Advancement of Democracy in Sierra Leone, WOLEAD, are a feminist partner. Core Global drives the monitoring and evaluation, while Change really helped bring this innovation from Bogota to Freetown.
We are working as urban development institution, working in research. Actually, our role is very key within this project, which is to bring out findings related to the drivers of how care responsibilities are shared between men and women in informal settlements, you know. So we are doing a series of data collection. The first part is going to be a needs assessment, which is just scoping, the community to see how, the drivers of relationships, cultural, patriarchal, and those kinds of things, how they shape how care roles are shared between men and women within the settings. And then after that, we're going to do a baseline. So the baseline is more of a quantitative survey, which will kind of set the anchor, that will show us what is the base of where we are at the start of the project.
Care is a gender equality issue in the globe, in our continent, Africa, and in Sierra Leone. Caregiving is something that has long been, silenced or kept under the carpet, where there is so much inequalities when it comes to care, because women, especially this part of the continent that we come from, face the burden of care.
According to what they explained to me about the CareBlocks project, it will assist me and the woman who will get chance, we will go left with picking at the same time, because if the woman who can't quick or me can't quick, that is a big help for us so maybe picking go there. That we don't make good mind go rest.
Understand say they can make the care for we picking them, like we hold the put to picking them. Distance school we do business, we go left there. When after school back, we go back, we go take them. So if this the care don't come make for winner, and then we now, so we can able left for picking there as much as a time. We can able do business back. When we don't do business now, we go take them.
Abu Alan this skin okay because I don't say Abu Alan. But I not be get post to start left me picking with me granny. But when don't can near me so now, I will go for Alan. I no say now, I don't get side, to start left me picking with me granny. But I no say that they safe, so I will go learn my skin. If I get more time, I will go learn other skills. From there I can rest.